So you wear lots of hats in your work. Can you tell us briefly about the different roles that you have at the moment?
Yeah, I started as an academic, and you go through the early phases of your career, writing papers, presenting at meetings, etc. And then some of us suddenly realise that actually there's more to life than just producing papers and running departments. And especially as you grow a little older and you get a little closer to your retirement age. And at that point I thought, well, actually there's a lot of what I do which is commercially exploitable. I had no idea how to do it, learned very quickly. And so now I'm in a situation whereby I still run an academic department within a university, but at the same time have a number of roles running various elements within startup companies. Many of which have been extremely successful and gone on to trade sales.
Excellent. And which role are you finding particularly exciting and challenging at the moment?
At the moment, actually, it's quite interesting because we've just won a major government award of £26.5 million to create a centre of excellence for our research at Moorfields. When I say create, to create an even better centre of excellence at Moorfields. So that's very exciting, and that's taking up quite a lot of time. But at the same time, there are two new areas that have come through research to a sort of commercial endpoint. One of which is concerned with refractive surgery, and that's the potential to use microwaves instead of lasers. So produce a refractive change in the eye without actually cutting any tissue away, and to be able to lock that change in by using cross-linking technique using ultraviolet radiation. So that's exciting.
Okay. So what for you is the most significant development in ophthalmology and medical devices in the last 12 months, and why?
Well, I think over the last year or so, the most significant developments have been the introduction of the first therapy trials for retinal conditions, and more recently the granting of regulatory permission to carry out embryonic stem cell transplantation in relation again to inherited retinal conditions. And I think these are very important because they bring ophthalmology into areas where we just haven't been before, and they will have a huge impact on sight-threatening disease. So for me, if I was starting today, I'd probably have a profound interest in one of those two areas.
And in terms of the next 12 months, what key trends do you predict?
Well, I think it's going to be in terms of the increasing knowledge in cell biology in relation to a number of ocular conditions. Because once you understand why the cell biology is going wrong and have some feeling for the underlying chemical defects, you can begin to look at the potential for utilising pharmaceutical agents. So just the same way that Avastin and Lucentis have had a dramatic impact on the way we handle in the first instance wet AMD and more recently diabetic vasculopathy, I think we will see a profound change in the use of pharmaceuticals in the coming year or so. Mm. And I guess if I were a VR surgeon, I'd be a little bit concerned because by treating these conditions earlier and earlier, I think they're going to see less and less of a workload.
You've trained quite a few fellows over the years. What's the most important thing that they've taught you?
I guess never to say never. And the reason I say that is because most youngsters, when they come, they have somewhat naive ideas. These days they've really read around the subject. But I've learned not to discourage individuals like that. Many people would say go away, read about it and then come back. I really say, well, let's try and see. And I can't tell you how many times I've been surprised that that sort of naive approach has actually resulted in some really useful stuff. The really, really interesting thing, though, is that these individuals have so much enthusiasm and so much energy, and that's catching, and that drives laboratories forward. So you absolutely have to surround yourself with young people, and most importantly, you have to listen to them.
And lastly, should a proper gin and tonic be served with lemon or lime?
Well, I'm an Englishman in the Bond era, and I guess it absolutely has to be served with ice and lemon, but I don't really mind if it's shaken or stirred.